I'm very excited about our episode today. My guests include Dr. Jaclyn Schneider, a medical director with United Health Group and formerly a physician with the Veterans Administration. We also have the 420 Chief, Ryan Johnson, a retired Navy Chief Petty Officer. Ryan is an author, podcast host, and founder of Break Stigmas, a nonprofit organization, and he's coming to us from St. Louis. Robb Harmon is the founder of Veterans Cannabis Care and HSIC Marijuana Express, MD, and he's coming to us from the Orlando, Florida area. Welcome, Dr. Schneider, Chief Johnson, and Robb. All right, so we'll start, and some of these questions will be for the panel, and some other questions I'll direct to a particular guest. So for the panel, the relationship between veterans and cannabis has a complicated history. It's been both stigmatized and quietly relied upon for decades. In your experience, where does that conversation stand today compared to maybe even 5 years ago? Well, can you describe your organization and why the flyers are there?
Sure. We pay for 100% of the cost of veterans to get the cannabis card here to Florida. A typical cost to see a doctor is $199, and then state fee is $77.75. So we cover 100% of that cost. We do all the registration for them. So they literally come in, we give some education on terpenes and the dosages and try to teach them about it because a lot of people are new. And they come in, they're licensed, they go to the dispensary the same day, and hopefully they're getting off of opioids and having a little better life.
And Chief Ryan, what's been your experience?
For me, the biggest thing has been getting people to tell their stories of healing. When I first started, or even 5 years ago, it was hard to get any veteran to admit that they had tried cannabis. And so many, after I got started and started telling my story, I had people coming out of the woodwork telling me about their stories and usage of cannabis. So I've noticed the stigma for me is just being able to talk about it, talk about it with my peers, talk about the healing benefits of cannabis, not just the couch lock of cannabis.
Mm-hmm. Dr. Schneider.
I would say 5 years ago, veterans weren't going to say anything to us, right? They weren't going to talk to us when they came to see us in, clinic. They weren't going to really mention it. It's starting now where they're saying, hey, the state's legal. We know it's not on the federal side, but this is what we're using for our pain. Please don't give me those opioids that, by the way, no one blinks, bats an eye when I do that. But if I mention cannabis to my colleagues, I'll still say that my VA colleagues before I left the VA, they acted as if I was a pariah. For talking about cannabis, like I was just some crazy person. But on the flip side, I think the veterans are much more apt to telling their doctors.
All right, Robb, so what inspired you to establish Veterans Cannabis Care? What was the gap in the system that nobody else was filling that you saw the need for?
Well, there's a lot of gaps. The biggest gap was financial. I own a medical marijuana doctor's office here in Florida. We've been open 7 years. Last week was actually our 7-year anniversary.
Congratulations.
Thank you. We have 8,000 patients, and over the first couple of years of talking to so many veterans who wanted to join the program but just simply couldn't afford it. I don't have the $199 to see the doctor. I don't have the $77.75 for the state on top of the cost of the medication. So after talking to so many people, I just decided I'll pay for it, and then we've done 1,000 since then. So it just came from a need. My father's.
All right, Chief Ryan. So the name 420 Chief carries a lot of identity and culture with it. How do you use your platform to shift the narrative around cannabis from one with a stigma to legitimate veteran wellness?
I went from a deck plate leader in the Navy as a chief. I was tried, tested, and accepted and earned the title of chief, which means to be visibly seen, to lead by example. And when I found that cannabis really saved my life, it helped me put the bottle down and stop taking, to date, all prescription medication that I had been given for pain, sleep, anxiety. And I started to tell my story and listen to others. When I heard, others finding healing and then heard others say that this plant helped save their life, I couldn't help myself. I had to make sure that others found these resources and this information for a safer alternative to healing.
So for every ailment, you receive the pill?
Yes, for every ailment, I received a pill. Anytime I've gotten any type of diagnosis from the VA, it's always accompanied with some type of prescription medication
Or two.
or multiple.
All right, Dr. Schneider, I know you're in New York, and I know you have an interesting story about your relationship with cannabis, both inside the VA and outside of the VA.
I do. I have been with my husband for about 26 years, and for the majority of our life, I just thought, I didn't know any better. He was consuming, and I just assumed it was for more of like a recreational, have fun type thing. But it was really for his PTSD. It was for his depression. And I honestly, truly believe that it saved his life. And meaning doctors, we threw pills at my poor husband. He was super flat, blunted, just wasn't him. And then once we got him off all of those things, and I honestly will tell you that in the morning, if I notice he hasn't consumed, he's different. He's not himself. And I'll often say, you should consume because you need to be balanced. You need to be you. But I worked for the VA for 13 years. I rose through the ranks. I was chief of palliative medicine. So I wrote a ton of opioid prescriptions. I wrote benzodiazepines, such as like Ativan, Xanax. Nobody cared. So, I took care of ALS patients. And then at the end of my career with the VA, I was acting deputy chief medical officer for all 9 hospitals across New York and New Jersey. And yet someone saw an article in Buffalo Business First about me and my husband having a hemp dispensary, and they turned me into the Office of Inspector General. So I actually was investigated by the Office of General Counsel in DC. They looked at my websites, they looked at everything. And at the time it was hemp. So it didn't matter. I said, no, this is legal. Like, there's no reason I can't do this. I don't consume myself because I couldn't. They drug test us randomly. Couldn't even use CBD tincture. No THC. You can't have it. That's just end game. So essentially, once we opened up our cannabis dispensary, where we really did it to help other people in the community, because the medical system in New York right now is kind of falling apart a little bit.
And
There's
you
no
are a New York licensed retail dispensary owner.
I am. We are a New York licensed retail dispensary. Once that happened, I had to leave the VA because they essentially told me I had to.
Now, what does the current body of research tell us about cannabis as a treatment for PTSD? And what are the most significant gaps that still exist in that research?
A lot of physicians will say there's no data, there's no research, there's none of this, but that's not true at all. In fact, there's probably more data for cannabis use in terms of pain, PTSD, depression, sleep. There's more data out there than there is even some of our, gabapentin, for example. That's a very common medication that we give out. And if you look at the data, it's actually not that great. Has tons of side effects. So the data is there, but a lot of it is done in other countries, Israel, Canada, and US physicians tend to not honor those studies. They want to see, double-blinded studies in the United States. And so, as you know, like, I'm not going to look at a study that's done from cannabis in the United States where it's done in a, using 4-year-old cannabis that's been sitting in some God knows where warehouse under horrible conditions. And the reason they're doing the study is actually to look at harms. They're not looking at benefits. So we have a long way to go when it comes to US studies, but I will say they're out there. It's just that we're not paying attention to them.
Now, Rob and Ryan, as the doctor said, many veterans are still being prescribed opioids, heavy antidepressants, among other things, by the VA. What are veterans telling you about why they're choosing cannabis? And are they using cannabis alongside those other treatments, or rather instead of those treatments?
And when I started the podcast, that was the first thing I really noticed a big pattern in with veterans was how many veterans said that they were actually able to stop their usage of prescription medication. And so many of them, like myself, had some extreme story of what made them hit rock bottom, oftentimes having blackout situations and finding themselves in severe legal trouble, oftentimes losing their family, losing custody of their children, divorce. And so they were at that point willing to try anything to save their life, to save their livelihood. And that's how oftentimes many of the interviews with veterans I've done found their way to cannabis.
Now, do they stop on their own, or do they do it in consultation with their physicians?
99% of the time, folks didn't even realize when I interview them that there are such thing as green certified doctors that they can talk to. That's another thing that I love to bring awareness to on my podcast. But no, oftentimes it's just a buddy of theirs said, "Hey man, you really need to calm down. Have you thought about trying cannabis?" And so they'll either try gummies or they'll smoke with them and find that it helped them pretty instantaneously. But no, it's usually been something that they've found on their own.
Now, Chief Ryan, I know you do a lot of advocacy. So, for veterans that are living in states where cannabis is still illegal, what resources or guidance do you offer, and how do you help them navigate that legal and possibly personal risk?
In the recent history, we've relied heavily on hemp in a lot of states where cannabis isn't legal. But
Mm,
with the impeding hemp ban, that's something that we're going to have to readdress and figure out internally. There's veterans in states that can't consume at all. They're in a state where hemp nor cannabis is legal. So honestly, I can't condone that, and tell them to try cannabis if it's illegal there.
mm.
Um, I can just say use your best judgment. Um, so that's really kind of one of the factors that we're facing now with the hemp ban. Even in Missouri, they're pushing through to ban hemp November 12th, where many people, not just veterans, but children with epilepsy, Parkinson's, all kinds of folks will be losing access to medications that have helped them. So that's kind of a battle I think that we're all looking at the possibility of fighting in the near future.
Oh, absolutely. So, Dr. Schneider, and really the rest of the panel, while cannabis still remains on a Schedule One substance, are veterans at risk of losing any VA benefits if they consume?
So that is the number one question I'm asked every single solitary day.
Mhm.
They are not at risk for losing their benefits, but I always put like a little asterisk in there. Their service connection, well, as it stands today, should not go away. It doesn't go away. It's not like you can't come into the VA hospitals anymore and access the care. But what does happen is often the veteran who admits to their physician, which, we would like for people to be open to us. But then once you do that, if you're talking to a physician, pretty much any, except for maybe me and a few others across the country, they would put a cannabis use disorder tag in your chart. And so, or a substance use disorder tag. And so that plops right into your problem list, and that carries with that veteran for a long, long time. So the benefits stay, but then you have another problem.
For veterans I've spoke to across the country that have talked to their physicians at the VA about cannabis use, I've heard a couple of cases when they were on other medications and the doctor said, "If you use cannabis, I have to stop these
Mm.
other life-saving medications." And so that
Yes.
was something that's been very concerning of me. It's not so much they're penalized for their cannabis usage, but they can stop other medications if they deem it impacts them and shut it off instantly, which is dangerous.
Yeah. Is that truly medically indicated, Dr. Schneider?
So in the VA regs, when we say that we're going to prescribe opioids, not every VA physician can. You have to have in the pharmacy, the pharmacist actually puts in that you have gone through training and that you're okay to prescribe Schedule, one drugs and or because we can do things like ketamine, etc. However, once those substance use disorder tags go in or the cannabis use disorder, once that goes into your problem list, in theory, the regulations around controlled substance prescribing says that we're not supposed to prescribe those and that we're supposed to cease prescribing them immediately. Things like Lyrica, gabapentin, opioids, all kinds of stuff. So just like 420 Chief was saying, that's what happens, that we just are supposed to shut off the spigot and just say like, sorry, here, no more meds for you.
Now, do each of you speak to physicians groups who are still reluctant, to recommend cannabis out of, whether it's professional liability concerns or lack of training or just, skeptical about the research?
I've spoken with my own VA doctor and several others about not just cannabis consumption, but topical products as well. I've heard so much feedback just from selling my own topical salves of people that are able to stop taking an Aleve or an ibuprofen every single day. And even hemp seed oil itself has studied to be more effective than Valtorin gel, which is what the VA prescribes. That's the only topical I believe the VA will prescribe for pain and inflammation.
Dr. Schneider, you reacted positively to the mention of topicals.
I did. My husband actually, several years ago, crafted a topical in our kitchen. And I have to tell you that and now our store, actually carries, its own topical brand, for that reason. People don't realize, especially the people who are like, I don't want to get high. Well, here's a great way. It works. I have to be also honest. As a physician, I was skeptical. I was like, meh, Voltaren gel doesn't work. And like, I mean, it really just, it's something we give, like lidocaine gel. Maybe it works a little, but it doesn't really work that well. So I was like, all right, I'll try a topical. And then so many people are like, oh my gosh, I can't tell you. This is like the first thing that actually helped my arthritis pain. I was like, oh, okay. All right. This is getting somewhere. But when you said something about, talking to physicians, man, they just don't know. They just don't know what they don't know. We're not taught this stuff in med school. We lecture. I used to run a fellowship at the University of Buffalo, and, trained hospice and palliative medicine fellows. We would talk to them about it, and they would know that, I myself, have done med cards since 2018, and the local cancer center that we have here, Roswell Park, they have a cannabis, kind of clinic. But even when you talk to them, they just don't get the whole breadth of cannabis. They don't get terpenes. They don't get, they're just like, they need a 1-to-1. Well, not everybody needs a 1-to-1, or they can't smoke. Oh my gosh, they can't smoke. Well, not everybody can, take edibles. Not everyone can even metabolize them. My own husband can't. He could eat 2,000 milligrams and look at me and be like, I'm fine. I would be unconscious. So, it's the lack of knowledge is real.
Yeah. Do you get a lot of veterans that come to your dispensary?
Tons. Tons. We give a veterans discount too, obviously. I may not be at the VA, but I have a real soft spot for veterans. And it still hurts me to this day that I had to leave under forceful. I wasn't fired. I wasn't told that I had to go, but it was basically make a choice, and I chose to stop prescribing opioids and things that they handcuffed me, and I said, nah, I'm done with this. So yeah, I mean, we get tons of vets, and I love when they come in with their hats, USS something or whatever. As soon as I see that, and some of them don't tell me initially, but they end up opening up, and they tell our staff, and it's important. They use it more than we realize.
So now, as we all know, there's been discussion around rescheduling cannabis at the federal level. Now, if that happens, what changes first for veterans? Does it do anything? Does it unlock anything?
I have actually had this exact conversation with the Office of General Counsel, because I thought maybe I won't have to leave and rescheduling will come. But, as you see, that's not happening. And I'm not a super fan of putting it under Schedule 3 either. It doesn't help people who have been sitting in jail. It doesn't help, anyone with, criminal records, etc. But I said to them, does that mean that the vets can have full access? And Office of General Counsel told me, we'll see. It's going to depend on the language that's put in, how DEA writes it, how all that stuff is actually put out. It probably will make it a little less stigmatized, but it doesn't mean that vets are going to be able to freely get it, and not have those issues that I've talked about before.
Yeah, and just to be clear, you're talking about the Office of General Counsel at the Veterans Administration.
I am.
Chief and Rob, would it do anything? Would it provide any benefit to veterans to have cannabis rescheduled?
I think more than anything, it'll help get the information and education out around the healing benefits of cannabis. there have been so many studies, both medically and independently researched, to show so many benefits that are being held back. And I think that what rescheduling really will do will allow that information to come out, to allow it to be retested and reconfirmed that these things are happening. And I think the entourage effect of once it's rescheduled, then maybe changing some of the other policies and laws that are in place, um, even Second Amendment rights, things like that, I think will change, and that will help people come forward to encourage them to try it themselves.
Now, if you could design an ideal evidence-based cannabis care program specifically built for veterans, from the ground up, what would that look like to you, and who would be responsible for running it? We'll begin with Dr. Schneider.
That's a great question. And I would love to hear it from the people who are truly doing it. Like the two veterans on our panel. Like, please, I would love to hear what they have to say before I even say anything. So I think
Okay.
you two will have more insight than I ever will.
All right, Rob and then the chief.
Ask me this question again.
Okay, I'll ask the question again. If you could design the ideal evidence-based cannabis care program specifically built for veterans, from the ground up, what would it look like, and who would run it?
Well, from ground up, I would have doctors that actually believe in cannabis. We would do a lot of research on, the cannabinoid system. We would definitely utilize some of these other cannabinoids that aren't being utilized now, like CBG, CBGA, as a normal part of the regimen, and just kind of work through plant medicine part of it. I think that cannabis is the Bayer of the 21st century. It's the very tip of the iceberg, and I think if we can go to the Schedule 3, that'll maybe help too with research and moving forward too. But I like to encompass that into their normal regimen is cannabinoids.
All right, terrific. Chief?
I think to add to that, you said to make it like your dream veteran program, I would have a process in place to then hire veterans to grow cannabis, because growing cannabis in itself is highly therapeutic. Aside from doing podcasts in the morning, I love to go walk the Garden of Eden with my coffee. I look over my plants, I check them for mold, I check them for bugs, I check to see if they're deficient in any nutrients or water, sun, etc. And I have found tremendous healing just in growing those plants, and that's actually led me into growing produce with my children around the house. But I would include that in the program to have X amount of veteran cultivators, X amount of veteran-owned dispensaries, and I feel that by doing it that way, you're going to get a cleaner product. You're going to get ultimately more healing for more people, people that really care about what goes into the product. And as a result of that, the consumers will get a much cleaner, cared about product that they know works. And like Rob mentioned, with the right cannabinoids in them, the right terpenes in them that are for healing, not just recreational benefit.
That's terrific. Thank you.
That's why I wanted to hear what they had to say. Because that was really brilliant. I didn't even think about having veterans be a part of, seed to actually sale type of situation. That I think would be life changing for many. But I agree very much with Rob as well about the minor cannabinoids, or, I took CBG this morning. I took CBGA this morning. People, even dispensaries, good luck going into a dispensary, even a medical dispensary. Good luck going into a medical dispensary and asking about, CBDA and all things, they have no idea. No idea. And they do not know when to take it, how it works. So many of like this. So I think having the veterans, that I would love to see, this is what my concern is. I would love to see whether it be a clinic or however it is, like a research facility, where veterans didn't feel worried and scared about coming in the door. It happens at the VA hospital. Some veterans won't even seek service connection, won't even try to go there because they can't step foot in the door. They can't even go into the hospital because of a variety of different reasons. So a welcoming place, and totally agree, like actually having them work there would be, that changes the whole model. But you can't just do research on, does THC help this, that, and the other thing. It just doesn't work. We're talking about hundreds and hundreds and hundreds of research trials that have to go off. So, but I think the number one thing is you got to compensate them. Can't tell them to come in, a veteran to come in for 8 hours and then just be like, well, that's nice. Do you get, a stipend? Is there a grant that's going to pay? Like, that would be what I would love to see is there going to be a grant that's going to pay the veterans for actually doing this? They, in some senses, have been guinea pigs for a lot of different things. And so, why not actually compensate them for their time?
Yeah. Are you in touch at all with the medical director and the folks that in the medical program at the New York State Office of Cannabis Management? Are they doing
Well,
anything in this regard?
yeah. So, Dr. June Chin, recently took office somewhat recently at the Office of Cannabis Management. And I think there are so many things in New York that are issues especially when it comes to the medical program. I don't even know if you all realize there are very few people in the program now.
Mhm.
At its heyday, there probably was somewhere over 110,000, patients, and now there's much less than that. The medical stores have closed in Buffalo. Right now, we only have one, and I know it's closing in June. So they will have no access to medical cannabis whatsoever, which means the tax issues, the milligram issues will continue because we can only sell 100 milligram per package, and in medical stores you can sell more. So I think that Dr. Chin and the folks at Office of Cannabis Management realize that. I just think this is a much larger issue. Like, what do you do when a state operator with
Mhm.
worth billions of dollars is pulling out of the state?
Right. No, and I know that they are very concerned about the state of the medical program at this point. So now, to all of you, for a veteran that's listening right now who's quietly struggling, maybe on a cocktail of medications that isn't working, and curious about cannabis but afraid to take that first step, what do you want them to hear from you specifically today? And we'll start with the chief and Rob, and then the doc.
Talk to your buddies. We all know somebody that does consume or that has consumed, that has found success with that. And if you haven't, do your independent research. That's the biggest thing for me is do your own research and find out what might help with whatever your ailment is, but always start slow. That's the biggest thing. The horror stories that I've heard most often are because folks didn't start slow. They started off with a full gummy or a full beverage, or they hit the bong way too hard, and it doesn't take that. Oftentimes, it takes very, very little when you're just getting started. You can always add a little bit more, but you can't ever just back it up. So definitely find information on your own, do your own independent research, and then start slow.
Yep. Go low and go slow, right? That's the mantra. Rob.
You've been socialized and brainwashed your whole life that what you're taking that will help you, especially if you've had experience with it. Don't be scared. There's people out there that will help you. The VA is not going to hopefully deem you bad for it or lose benefits or any of this or that. So don't be scared. Reach out. There's plenty of, you can give Veterans Cannabis Care a call at 866-998-0420. Ask for Rob. I'll talk to you forever about it. So just don't be scared. It's for your health and your benefit.
All right, Dr. Schneider.
Yeah, all of that advice is perfect. I do agree that it's tough. You want to say, well, I'll just talk to my doctor about it, but that's not going to get you anywhere. I talk to, I think go low, go slow is perfect, but also I agree. Find someone that knows who has taken this stuff before, who has some sense of what, not just, oh, I just, I get high every day. It's, someone who has gone down this road. And I agree with Rob as well, too. If there are organizations out there, that's who you should reach out to because you've been through this, how to guide them. And unfortunately, and it's not your back. It just isn't. You're not going to get what you need out of them. I had to probably change my husband's doctor multiple times because he even was kicked out of his psychologist's office. She said, well, I can't treat you if you're consuming cannabis. He said, well, then you can't treat me. And he left the psychologist's office and looked at me and said, what the heck am I supposed to do now? I was just my own non-judgmental psychologist judged me. And he goes, I don't want to do this ever again. And I thought, oh my gosh, how am I going to get him help? But and it's tough too, because you can't really walk in, and at least in New York, you can't really walk into a lot of the med dispensaries because there's just not that many. And if you're in rural counties, good luck. I wish as a physician that I could sell both medical and recreational in my store, but New York doesn't allow it right now. Even though I've been doing this for years, I consume. I didn't at the VA, but I do now. I consume now that I've been, out, but I use a lot of minor cannabinoids. So yeah, I just think, asking a buddy or Googling, what veterans organizations are out there, they'll help you. That's who you got to ask, not the docs. They don't know.
So, as we close today, is there anything else that you'd like to add that we didn't get to touch on? Or just tell us where we can find out more about the work that you're doing, the organizations that you're with? So,
I wanted to talk a little bit about dispensaries and access, because the initial problem is free access, especially in a state that's only medical. The dispensaries and all in Florida, there's only 28 licenses, and they're all vertical. They're all cheap. They don't give a lot of money. People don't realize that giving them a 20% off in the dispensary doesn't really do anything if you can't afford the $199 to see the doctor, the $139 every 7 months to see the doctor again, the $77 to $75 to see the state. So it's about access first, not afterwards.
and tell us about your organization and where people can find out more. I know you gave out the number a little while ago.
Sure. It's Veterans Cannabis Care. We're at www.veteranscannabiscare.org, or you can call us at 866-998-0420.
I know, you and I spoke previously, and one of the things that impressed me was not just talking about, how cannabis saved your life, but also how it really reframed the relationships in your family, and that was pretty impressive. So tell us more about all the stuff that you're doing. I know you're doing a tremendous amount.
I really am. Real quick, I wanted to let folks know, let the listeners know that other countries have gone through this. Like Canada, they offer as an option to their veterans 2 grams a day. So their VA actually pays for that safer alternative for them because they know that there's an overprescription pandemic. They're aware that it's a global veteran suicide crisis. Not that doesn't just end here on our soils. Other countries have acknowledged that and are offering their veterans safer alternatives to things that really are helping them heal and become better. I do interview veterans and get their stories of healing out. That's on my YouTube podcast. You can search that 420 Chief. 420chief.net has a little bit of that catches everything that I've got going on. I do host meetups as well through my nonprofit, breakstigmas.com, where we get veterans out of isolation, get them together at different types of meetups. I do have one coming up in May focused around cannabis called DD420. Lots of amazing resources that will be there in the cannabis field and outside of that, as far as service animals, veterans' mental health, all kinds of different things. And you can find more information about that at breakstigmas.com. And I also have the topicals, sunnysideofchief.com, where we make CBD isolate and full spectrum topicals as well as bath crumbles.
Oh, terrific. Thank you. Dr. Schneider.
I wish I could say, hey, I have all these things in New York. Come to us. We've got all these things going on, but it's been really tough to try to actually move the needle. Just was at the OCM meeting yesterday, and there was a veteran who was super impassioned and talking about kind of left us behind. I don't know if you all saw that, but actually, our chief equity officer at OCM apologized to the veterans and said we haven't done enough. So I just, I have our dispensary is called Green Philosophy 716. It's in West Seneca. I agree with you. The discount's not enough. Thankfully, they don't have to pay med cards to come in, but the excise tax is there. That New York State tax is 13%. Thankfully, it's not like Michigan or other states where it's exorbitant. But it's expensive. That's the number one thing I hear from people. It is too much money. I agree. I don't know how to get it cheaper. Like I said, I wish I could sell medical and recreational at the same time to kind of help buffer that. Thankfully, New York now allows us to do 2 years of certification. So you only have to pay the fee once every 2 years versus seeing a doctor constantly, but it's still money. So, you come in and you get can sometimes get like an eighth for like $40, but sometimes it's, that's $40 that you had to spend on food. So it's tough. I wish that we could have more programs and better ways to help veterans afford the care.
Well, I want to thank you all for all the work you're doing supporting our veterans, and for rearranging your schedules, because I know it was tough to make sure that we could all get together today. So thank you very much. Be well. Have a great rest of the spring.
Thank you. You will.
Thanks for having us.
Thanks for helping us get this information out there.